I'm Rachel. I am a family medicine doctor, so I see all kinds of people, pregnant women, children, and hopefully we'll be doing addiction medicine in the future. I am originally from Tennessee, but I did my medical school in Philadelphia. I'll just go over the agenda. I'll talk about harm reduction a little bit. I want to talk about the difference between tolerance, dependence, and substance use disorder, which are some terms that we can use to define how medications affect our bodies. And then I'll talk about some common drug classes that I think of when I think about prescription medicine that might be at a risk for where we can add a little bit more harm reduction. And then we'll talk about some risk factors for harmful prescription drug use, as well as some principles for ways to use your prescription medicines in a safer way. So first of all, harm reduction, it accepts that for better or worse, illicit, which would be those prescription medications, and illicit drug use is part of our world and chooses to work to minimize its harmful effects rather than simply ignore or condemn them. A lot of times prescription medicine, you get it from your doctor, right? You're taking it in a way that you were told to take it. And sometimes that can lead to harmful consequences, whether it's being taken appropriately or not. And so there's always ways to reduce harm when it comes to things that we put in our body. The goal is to eliminate harm, not necessarily eliminate use. I think that's really relevant to prescription medications because every time I'm prescribing a new med, I'm thinking about, can this harm the patient? And so it's not always just about the illicit drugs out there. It's also about the things that doctors are prescribing you. And so this is the spectrum that I use to think of prescription drug use. It's less of a line and more of a circle in a way, but there's ways to appropriately use prescription medicine. So you might be prescribed an opioid for pain that you've been taking for years and it works well for you and you're using it as prescribed, and that is considered appropriate medical use. And then there might be times that someone is using prescriptions for a non-medical use. It's been helping you with this one part of your life, so then you're taking it for another part of your life. And that doesn't necessarily mean that it's inappropriate. It just might mean that you're taking it outside of the way that we described as to how it was prescribed. And then we'll talk a little bit more about substance use disorder and what that means. And someone could be appropriately using their medicine and then like in this circle end up with a substance use disorder. And they might have never taken it in a way that wasn't prescribed. It's just like this transition that can happen. And so I'll talk a little bit more specifically about what substance use disorder is. But there's so many different ways prescription drugs can be used. And so I think it's important to know the different ways that I like to think about it. So these are two words that I think are really helpful: dependence and tolerance. I'll start with dependence. Dependence is a biological process where a reduction dose leads to signs of withdrawal. So say that you take a medicine for your blood pressure, and this medicine that lowers your blood pressure also lowers your heart rate, and you've been taking this medicine for months and months as prescribed. Your body's going to get used to that medication, right? You've been taking this new medicine, your body's getting used to it. And if you were to stop taking that medicine, then your body might show signs that it doesn't have it anymore. And so with this blood pressure medicine, sometimes people will take this medicine, they'll stop taking it, and we'll notice that their heart rate will go up. And we call that dependence, meaning that their body got used to the medicine and it was then dependent on the medicine. And that in itself is not a problem, right? Like we expect people's bodies to get used to taking a medicine, just like we expect people's bodies to get used to if they eat a lot of salt, right? They'll maybe be a little bit more thirsty. Your body likes to stay balanced. And so it's going to do the best to make that happen. And so we think about dependence when we think about someone's response to a medication they've been taking for a long time. There's also this term called tolerance. And this is the need to increase the dose of the medicine that you're taking to reach a desired effect. And a way to explain this would be, say you're admitted to the hospital because you broke a bone and you need pain medicine to help treat the pain that you have from that broken bone. If, say, you've been in the hospital for a week, the medicine's been working really well for you, and then the next time you take your next dose, you realize, hey, that didn't help as much as it used to. Something's going on here. That's most likely because your body has now become tolerant to that medicine dose. So your body's gotten used to it. And so to achieve that initial effect that you had, you have to take a higher dose. And this also in itself does not mean that someone has a substance use problem or that they've been using the medication inappropriately. It's just another way that your body responds to medicine that you take. These two terms are really helpful when we think about prescription drugs and the ways that your body can react to those. Now I'll talk a little bit more about substance use disorder. We like to call it a chronic disease. It's something that can come and go almost, and it's something that we have treatment for, but it's where people compulsively seek and use drugs despite harmful consequences. This can look a lot of different ways. I think that when it comes to prescription drug use, often it's someone that's taking the medicine as prescribed, right? And then all of a sudden they notice that they need a little bit more than they used to. Or when they don't take it on time, they start to feel sick. And then eventually sometimes that can tumble into this compulsive behavior to take it even when they may not need it, or to take it just to feel okay. And I think this harmful consequences is an important point, because oftentimes those harmful consequences can look many different ways. It could be withdrawing from family or friends, or having trouble completing your daily tasks, whether that's keeping your house clean or getting to work or anything like that. It can also look like harmful health consequences. You're noticing that you're not feeling well, but someone still feels the need to use this drug. And so these are just some of the symptoms I start to think about with substance use disorder. And this is a really broad graphic and not the most specific, but there's lots of different ways it can affect us. It can affect our mental health. Someone might not feel like themselves if they start to feel like they're using a drug too frequently or too much. There can be some mood changes, some paranoia. There can also be lots of physical signs. There can be headaches, weight changes, whether that's weight gain or weight loss. There can be disruption to sleep cycles, and then some other behavioral things that can happen. Might not feel like you can share what's going on with your friends or family, or someone might feel like this is something that they aren't able to talk about with other people. Someone might not be as interested in the things that they used to be doing every day, whether that's going for walks or cooking dinner. They might just lose interest in their day-to-day activities. And these are some signs of substance use disorder. This by no means would diagnose someone with a substance use disorder, but I think it's important things to think about when we think about that transition from where I'm using my prescription medications like my doctor told me to, but I'm starting to notice these other things like tolerance and dependence and changes in my life that make me think maybe this medicine that I'm supposed to be taking is becoming somewhat of a problem for me. Or I'm noticing that someone in my life has been taking this medicine that's been helpful for them before, but now it's starting to be something that I'm a little nervous about them taking. And then I just want to talk a little bit about what causes substance use disorder. There's a lot of factors that go into it. And I think it's really important to frame substance use disorder as a disease because there's a lot of stigma associated with it. There's a lot of stigma in the general public and the medical community. I know that people with substance use disorder don't really want to go to the doctor because they're scared of what the doctor might think about them. I think it's important to talk about what leads to substance use disorder, to take some of that blame off the person and make this less about a personal choice and more about a disease. In the same way that someone can get diabetes, someone can also develop a substance use disorder. One thing that we think about is biology. Genetics can account for about half of a person's risks. If someone grew up with parents that use substances, they're at an increased risk for using substances themselves in a harmful way. There's also predisposing mental health factors. Culture, the culture that you grew up in might predispose you to use more substances in a different way than others. There's also environmental factors, family, friends. Were you exposed to drugs at an early age or to alcohol at an early age? Did the group of friends you hang out with use all of these things? And then key stages of life. Someone's at a higher risk for substance use disorder if they're going through something really stressful in life, which makes sense, right? They've had a death of a loved one. They're moving to a new place. They've lost friends for whatever reason. Their relationship isn't healthy. These are all things that can predispose someone to a substance use disorder. That doesn't always mean that just because you might have some of these things, you will get a substance use disorder. It's just some of the things we think about for risk stratifying. I want to talk a little bit more about tolerance and dependence and substance use disorder in the form of an example, just because I think it's an important thing to understand. This is Sam. They were recently prescribed a medicine for their anxiety. They're given a 2-week supply and they're told to take it twice a day. They've been taking it twice a day just as their doctor told them. But when they run out of their prescription, they start to notice that they feel more anxious. They notice they're a little bit sweaty and that they're nauseated from not taking this medicine. So this would be like a dependence. Their body's gotten used to taking this medication. We can say is dependent on this medicine. This doesn't mean that they were using it inappropriately or that they now have a problem with this medication. It just means that their body responded in the way that we expect. It just means that their body is doing what we think in the sense that it's getting used to this medicine. And so when you stop taking it, your body reacts in a different way.
And that can be one of those reasons too, when they say if you're going to stop taking a medication, you need to talk to your doctor because you can experience things like this.
There's some medicine that can be dangerous if you stop taking it too soon. Your body often does the opposite of what the medication would do. So right now your body is out of control and it probably doesn't feel great. You'll probably try to figure out a way to get it back in control. Next one, this medication, they had it for 2 weeks. They stopped taking it and then their doctor gives them a refill for the same medication. And then they notice that when they do take it, they've been taking it twice a day, but it doesn't work as well as it used to. It was working really well at first. They've been taking it consistently and now the same dose isn't working as well. Two options for this would be dependence and tolerance again. they're requiring a little bit more for it to work like it did at the beginning. And so I would call that tolerance. I wouldn't quite call this like a substance use disorder per se, because we don't know if this is affecting their day-to-day life, right? They might need a higher dose, but that doesn't mean that they're having those harmful consequences of missing work or not being there for their loved ones. This isn't always a bad thing. This is just something that we expect when people use medications. We are constantly increasing people's doses because we expect some amount of tolerance to happen, but we always start at a lower dose to be safe. And then this is a quick one. This is getting more into addiction. So they've started to notice that instead of taking the medicine twice a day, they're starting to take it 3 or 4 times a day. And they end up asking their doctor for a refill early. We're getting to signs of like misuse. This person is starting to take it not as prescribed, so taking it more frequently than their doctor had asked them to, which isn't always a problem, but it depends on if we're having those harmful consequences. I would consider this like an addiction or a substance use disorder. And really the best thing to do in this situation is talk to your doctor about it. We want to know if this is happening to you. We want to be able to help you because maybe you need to be on a different anxiety medicine, or maybe you do need to take it more frequently. We just need to make sure that we're doing it in a safe way. These are just another sign you can think about that. Is this medicine? Am I starting to develop a problem with this medicine, or do I just need to do something different? But we would always be happy to help you with that. And your doctor would rather know than not know.
That's good, thinking of it too as a sort of indication of what your body might need that you can then talk to your doctor about, as opposed to saying this is a problem. This is information about how your body is responding.
Absolutely. Because it might just mean that we need to make a change. It doesn't mean that there's a problem with what you're doing. It's just more information, just like you said. So I want to talk about some common drug classes. I know these are some bigger words, but I promise I'll give you examples for common drug classes that I think about when I worry about prescribing a medicine that might cause harm to someone. So the first one is opioids. The prescription version of these are often like oxycodone, hydrocodone, morphine. These are most commonly used for pain. And then there's also stimulants. These are things like Adderall, Concerta, Vyvanse. These are often used for ADHD medicine. These work by heightening your senses and making you a little bit more stimulated. There's things like gabapentinoids. Gabapentin is the big one. This is a very commonly used medication for nerve pain. So say someone has diabetes and they get nerve pain in their feet, or they have a pinched nerve in their back. Gabapentin, or it's also called Lyrica, is something that's very commonly used, but does have some side effects that we have to be aware of. And then benzodiazepines are the things like Ativan and Xanax that are often used for anxiety. In the past, these medicines used to be used a lot more than they are used now. I think that doctors didn't know the risk of this medicine as much, and it was prescribed for daily use for a long period of time. We've learned a lot about this medicine, and then it's not the safest for long-term use. Now we prefer to use this medicine for short-term anxiety treatment, but it's one that commonly we see problems with. And I'll talk a little bit more about mixing these medicines and which ones I worry about when we start mixing medicine. Something else to think about when we're talking about medicine are special populations. Older adults often need lower doses of medicine, or they're at higher risk for these medicines to cause them harm. Something that I worry about is if I give an older adult a medicine that can make them dizzy or lightheaded, will this increase their risk for falls? Something else to think about. Also, pregnant or parenting individuals. Obviously, with pregnant people, we think about what medications are safe for them and for the baby, but also for parenting individuals. Would it be safe for this person to have this medication in a home around their children? Or would this put them at risk for feeling too tired to take care of their kids or anything like that? Limited access to healthcare is something I think about. I like this little graphic because this person is like running and jumping through lots of hoops. So people who are really busy and can't make it to their doctor's appointment, or people who are uninsured, those are always things to think about. Can they make it back to their doctor's appointment for a refill? Do they have access to get these medications at the pharmacy? These are all special things to think about. And then also transition points. Something I think about is if someone goes to the hospital and then they leave the hospital, making sure that they have medication that they need when they leave the hospital and they have someone who can give it to them afterwards. Or if you're moving and you're not going to be in the same neighborhood as your doctor, making sure that it's safe. And you can let your doctor know if these things are happening. If you're like, hey, I don't know if I'm going to be able to come back. And we will do our best to try to help make sure that you have a safe plan with the medications that you're taking so that you can keep taking. I want to talk a little bit more about things that make me nervous when I think about medications and harm reduction around them. So one could be drug interactions. Certain medications don't mix well together, and I'll talk more specifically about which ones. But some medications make the effects of a different medicine stronger, and that can put you at a higher risk for overdose or at a higher risk for other medical complications. Some other things that I think about are your other medical conditions. So say someone has a lung condition like asthma or COPD and they have trouble breathing. Taking things like an opioid, which can cause that decreased breathing, can put someone at a higher risk for overdose. Just because one medicine might be safe in someone, it might not be as safe in another person because everyone has their own parts of their body that are working in different ways. I also like to think about cognitive function. Some of these medicines can make you pretty sleepy and confused. And I think that if taking all of these medicines make it harder for you to wake up in the morning and get out of bed and do everything that you need to do that day, I don't know that it's the most helpful medicine. And then obviously there's legal and social repercussions to some medication use. Every controlled substance, it's different in every state, is reported on, it's called the PDMP or the Prescription Drug Monitoring Program. All of this is reported. So if someone is prescribed an opioid, I'm able to see it on a website and it tells me how many they got, what dose, who prescribed it, and where. And it's important to know that if someone is picking up too many of these prescriptions, like this is stuff that is monitored. And then obviously the risk for overdose. We think about this the most when we think about things like opioids. That's one of the big things we worry about. With things like opioids, your doctor should be sending you Narcan to the pharmacy every time. If someone is prescribing opioids, that should be going with it as well. So next, I'm going to talk about some options we can use our medications in a safer way. First, I'll talk about dosage a little bit, and then I'll talk about mixing of medications, and then I'll talk a little bit more about safe storage of medications as well as safe disposal of your medicines. Overdosing, we've talked about how when you keep taking a medicine for a long time, your body gets used to it and you can build up things like dependence and tolerance. And that's not always a bad thing. We expect that to happen, but it means that your body is now used to this medicine. And so if you stop taking the medicine, it can be harmful and it can cause significant side effects. I think one that we often don't think about are the antidepressants of the world, like Prozac or Zoloft or Wellbutrin. These are really common medications that help people with anxiety and depression. But if you've been taking these for a long time and then you miss a few days, you might notice signs of withdrawal or that your body is acting in a different way. And specifically for antidepressants, it's not the most harmful. It's not like life-threatening, but there are times when it can be pretty uncomfortable. I'll say really quick as a fun fact, the only two substances that can be life-threatening from withdrawal are alcohol and the benzodiazepine. So the things like Ativan and Xanax. Those are two things that if you've been using for a long time and you stop, you definitely need to talk to a doctor about because it can be life-threatening. Something else to note is that medications all have different time to effect or a different time of onset. And so there's some medicines that you might notice an effect in 15, 20 minutes. There's some medicines that take a few days. So just because you take a medicine and you don't always feel that immediate effect that you're expecting doesn't mean that you should take a second dose because it might be too much if you do take that second dose and it might not supposed to work yet or it might take time to build up in your system. We also want to avoid things like double dosing. Some that we think about are insulin, which isn't something that we commonly think about people having an addiction to, but it is something that can build up in your system over time. It's a medicine that we use to bring down your blood sugar if you have something like diabetes, or also opioids. Double dosing on opioids could be dangerous. It's important to pay attention to what you're taking, and if you need more doses, talk to your doctor about it. And then, of course, your dose may not be the same dose as someone else's. Sometimes we do our dosage based on your weight or based on how your kidneys or your liver are working. It might be the right dose for someone else, and it might not be the right dose for you. It's important to know that, especially if you're thinking about taking a friend's medication, because that can lead to harm if done in the wrong way. I want to talk a little bit about mixing medicines. So I'll talk about the ones that specifically make me nervous. The big takeaway here is to talk to your doctor about all the medications you are taking, whether you want to stop a medicine that you don't like taking anymore, or you're like, hey, I've been taking this medicine and I think I'm going to start taking this too. Is that okay? You can also ask a pharmacist. Pharmacists are very trained in medication interactions, and sometimes they might even know a little bit more about it than your doctor. So you can always ask when you pick up your medicines from the pharmacy. So some that make me nervous for people to take together are opioids and then those anxiety medicines like the Ativan and the Xanax. Those put people at a higher risk for that respiratory depression or that having trouble breathing, essentially. Those make me nervous if people are taking those together. Something else are sleep aids. Ambien is a common one. And then muscle relaxers, which is a really common medicine, like a tizanidine or a Robaxin. They work really well for people, but they can make people really sleepy and drowsy and increase risk for harm. And then also lots of different medicines plus Tylenol. Tylenol has a very specific dose limit every day, so it can be harmful to mix Tylenol with other medicine, especially if you have something like liver disease or anything like that. And then, of course, alcohol and any prescription medicine. Alcohol can interact in lots of weird ways with medicine. It's important to talk to your doctor about the medicines you take, and if you also drink, to be like, hey, I do have alcohol occasionally. Is it okay if I start taking this medicine and I also continue to drink? We'll talk a little bit about safe storage. We want to keep our medicine away from children, preferably in the locked or secure location. But if that's not an option, somewhere that's out of reach. I know children are good at climbing, but trying to keep them in a higher place that children can't get to is always helpful. And then keeping medication in their original containers is helpful. But I say that knowing that a lot of people like to use pill boxes. And I think pill boxes are really helpful to keep up with the medicine you take every day. So just making sure that you or whoever helps set up your pill box has some sort of system to keep straight what you need to take and when. That's just a helpful way to do it, because when you start taking it out of a pill bottle and putting it into other bottles, things can get really confusing and it can be dangerous if you take too many or don't take enough of your medicine on a certain day. Also, don't share containers. So mixing a bunch of medicine into a bottle without a system isn't always helpful. It's important to try to keep it in its original container, because someone else might find the bottle and not know what it is and think it's something like Tylenol or ibuprofen, and it's not. So important to store your medicine safely. I also want to talk about disposal of medicine, specifically prescription medicine. So here's a little map of New York, and these dots are all the places where there's boxes for you to bring your prescription meds and they'll be safely disposed of. This is a mix of pharmacies in different locations. Most CVSs have the little med box that you can drop your stuff off in. But if you can't bring it to a safe location to drop it off, you can also dispose of it in the trash can. It is recommended that you mix it, not crush it, but mix it with something like dirt or cat litter or used coffee grounds, so that someone doesn't go through all of that to get it out. I feel like cat litter for me would be a big no. I would not want to go through some cat litter. And then you put it in a sealed container and then you put it in the trash can. You also take your bottle and you scratch out all the personal information and the type of medication, and that can go in the trash can as well. So putting it in the trash is an option with all of these steps, or bringing it to one of these locations is an option. Usually most pharmacies have a place for you to get rid of your medicine. Technically, you should not flush your medication. On the FDA website, and I have the link at the bottom, there is a flush list, which I actually didn't know about until I was doing a little bit more research. There's not many things on the flush list. I'll talk about it a little bit more. It's preferable that no matter what it is, you take it to a location that will dispose of it for you. But medications that are typically sought after and have a high potential for harm, or meaning that like if someone were to take this on accident, it could cause an overdose or it could hurt them, then it can be flushed. And when you look at the list, it's really mostly just opioids that are on that list. So things like fentanyl, oxycodone, hydrocodone, morphine, they think that it's better for you to flush those and get them out of the house if there's like a high risk, than to keep them in the house and wait to bring them somewhere if you don't really have somewhere to bring them. So technically, really the only thing to flush are those like scary medicines that can cause a lot of harm. Otherwise, they prefer that you mix it with something gross or bring it to a pharmacy to be disposed of. What to do if you notice that you're having problems with taking your medicine in a way that you think might not be how you started taking it, or you're noticing that a friend, something's going on with them and they're taking medicine and you're like, I think that this might not be helpful for you anymore. You can always talk to your doctor. We would much rather know what's going on than have you worrying about it. You can talk to a trusted friend, see if there's something that they've been through like this, or see if they're able to help you or help you get to a doctor's appointment. You can talk to a mental health professional. Find a trusted local organization. I like to make a note to just be kind to yourself and to your loved ones. Substance use disorder is hard and there's lots of stigma. A lot of times people are blamed for making bad choices, and that's oftentimes not the case. There's a lot of stuff that informs why someone might choose to use a substance in a certain way. I just want you to be nice to yourself if you find yourself in the situation, or be nice to your friend if they happen to ask you a question about it.
If you or someone you know is having issues with prescription medication, even if you just have questions about it, you can always reach out to SMART. We have connections with harm reduction programs. We do our own sort of harm reduction outreach, which gives us connections to a lot of programs in the area. So if that's something that you have questions about, or you're struggling with, or someone you know is, please let us know and we can help you make those connections. If someone is prescribed what is potentially addictive opioid after a surgery, how long is too long to be on it? Or is there no timeline and it's very much an individual situation?
That's a great question. It is an individual situation. I think a rule of thumb now is people do 3 to 5 days of pain management after, depending on the surgery. Some people might need longer of those opioids. And then we really try to do other things that aren't opioids to control your pain. But there are people who have chronic pain and they see a doctor who prescribes them opioids and they've been taking opioids for years. It's really just about knowing what's best for your body. Some people, if they know that they've had a problem in the past, they choose to not have any opioids and to try to figure out how to get through without those. It's really individual, and you can definitely tell your doctor and be like, hey, I'm nervous about taking this medicine. What are ways that we can be careful about this? Can you only send me a few because I don't want this to be a problem?
That's a good rule of thumb. Or there's certain things that we need to be aware of when we're talking about injections as opposed to like oral medication.
Sometimes people, for pain management specifically, say someone has knee arthritis, they might get a shot in their knee to help with the pain. That's not something that I'm usually super worried about someone missing in a way, because you can only get it so frequently. Or like some people get injections in their back to help with pain. Most people don't give themselves injections with a prescribed medication from a doctor at home for pain specifically. As far as like injection drug use goes, sometimes people are at a very high risk for substance use if they're using injection drugs. And so I think that just being careful around those in general is helpful, and talking to someone if you feel like you need help with injection drugs is always helpful.
Are those kinds of injections generally safe as part of it too?
I think those are great if your doctor thinks they're good for you. It's a one-time shot and they last a long time. And then hopefully you can take less oral pain medicine.
So it's harm reduction in that sense too, is that you're not relying on that in the same way that you might be otherwise.